So actually I did the same thing. I didn't eat from morning until about 6-7 o'clock. I do feel totally like a sack of potatoes, something like that. Very flat. I think it's the dehydrational part.
Dehydration.
Yeah.
So you say the cheat code for people to do intermittent fasting, OMAD, drink a lot of water.
No,
Yes.
it's to have depression.
It's the
Go and argue with it. Yeah.
Welcome to our first podcast for Tech MC. Okay, so we have Dr. Lye back here again from our pilot. Talk about random stuff, a lot of different products about Dr. Lye's GP start. One day, if you're interested, you can learn more about Dr. Lye's top story as well. Okay, and yeah, so we just, if you can see here, our decoration, a lot of Chinese New Year stuff, because we are on which day of Chinese New Year already? I don't remember.
I don't know.
Tuesday.
Tuesday, right?
Today is Tuesday, 1 week already.
Yeah.
Halfway.
Yeah, correct.
But it overlaps with Ramadan already, right?
Yes. So now we're getting very close. Actually, I think 2029 is going to be Chinese New Year and Aidilfitri at the same time. Hari Raya at the same time.
Oh, exactly. That means you all finish your fasting lah.
Yeah.
Ah.
So it will be
so early Wow.
Correct.
I mean, you started fasting in early February.
Yes.
Okay.
Correct. We'll move over
2029. That's 3 years. Yeah, 3 years.
So yeah, we just did the low K just now.
Yep.
Over here, that's our regular affair and we do at all of our outlets as well. So
yeah, it's quite an enjoyable moment.
So what we do for last topic, right? We were talking about some dieting stuff. We talked about BCA and weight, right? So since looking like we're into Ramadan and we're all fasting, right? So do you have any to mention about any fasting? I heard you were talking about intermittent fasting in the last episode.
Yeah. I've been always a little bit intrigued by this ever popular topic of fasting. The Western world is called intermittent fasting, and then what is the medical benefits associated with it? And then through my medical practices, like reading health screening report, I noticed that people who eat less, their HDL, the good cholesterol, tend to be a bit higher. So this is one way that I suspect you can push up your HDL, the good cholesterol. One way is through fasting. The commonest way of getting your HDL up is actually exercise.
Okay.
Yeah, but when I look at health screening, my experience from health screening interpretation, when I ask somebody that has high or low HDL, most of the time it's related to exercise. That means if the person has low HDL, this person tend to be very sedentary. And then the person is a relatively high HDL, the person tend to report a very active lifestyle. But every now and then I see exceptions. The old lady will tell me, I don't exercise but the HDL very high. So for the longest time I couldn't find the answer. Then one fine day I start to think, is it because he's eating less? Yeah. So I start to make this observation. Because there are another scenario is somebody who don't exercise, but yet his HDL is high because he doesn't eat much. So actually, generally, if you don't eat much, you can actually get your HDL up as well.
So what is HDL?
HDL is the good cholesterol, high density lipoprotein. It is supposed to be the one that take away the cholesterol plaque for you, whereas the bad cholesterol LDL is supposed to that will actually congest and form the cholesterol plaque in the blood vessels. So speaking of cholesterol, actually recently I was reading about tendon health. So one of the topics I was searching on is does metabolic conditions actually change the nature of the tendons? And I searched diabetes, the glycation, the glucosylation. Yeah, it actually can cause glycation of the tendon and make it more stiff. Then it parallels with me. I went to check does cholesterol make the tendon stiffer, and then there is suggestion as well. So actually this cholesterol has more than meets the eye this one is when I was doing research on our new platform called Stack, where it can actually it can actually assess your tendon function. Yeah, more stiff or elastic. So when I was doing research, then I asked our traditional focus of cholesterol and diabetes and realized that actually there's some kind of relationship as well. Yeah. So these are the things that I noticed lah. So basically, coming back to the focus, your exercise activity and your dietary habit is certainly the fundamentals of where our health goes towards lah.
So do you think that fasting in general is good for overall health, and does it combat like chronic illnesses like diabetic and cholesterol?
I think the general answer is yes. As a GP, I always use common sense, right? Fuzzy logic.
Okay.
Of course, we try to match it with scientific studies, whether eating more or less is good or not lah. So you know that post-industrialization, food is cheap, right? So then people start to eat more and more, and then you look at the general data, the incidence of obesity, the chronic disease, it goes quite well with industrialization evolution, but so I think rightfully everybody start to suspect is this the main reason or not lah. Then at the micro level, if you like for example in my practice during health screening, then we see people who eat more or eat less. Do they have a better health screening profile versus health screening profile? It seems to be so. So generally, eating less is a good thing for most of us. But having said that, there are people who took it a bit too extreme. I got a patient who been doing intermittent fasting for 10 years, and then he came and do health screening because he feels giddy.
Back to back, 10 years.
Yeah, he did IF for 10 years, and he actually complained that I got giddiness. Why am I having giddiness? So of course, when we do health screening, we have to be open-minded enough to consider malnutrition as well.
Okay.
Yeah, and how do you interpret malnutrition from the standard health screening data? Not that simple, but because basic health screening do not cover everything, but you have to deduce from the basic data and with clinical correlations from the patients. I mean that's the fun thing about looking at health screening lah.
What is your key indicators for a person who fasts or don't fast, or who you recommend to fast? What are the key indicators in your health screening?
So when you look at health screening, you can form this impression whether the person is too much or too little. So the classic for too much is your cholesterol is very high, your glucose is very high, your liver profile demonstrates fatty liver, right?
Okay.
Your sodium is high, yeah. And then when you're too fat, your kidney filtration rate actually goes down. Your renal function looks a bit funny, a bit lower than expected. So these are the too much people. Of course, the basic panel also shows hypertension, stage 1, diastolic hypertension, stage 2, 1, 2. Your BMI is very high. If you do body composition, you show high visceral fat score. So this person is too much, right? Conversely, the other side, this person's BMI is like 18, 17, and then his cholesterol is too good, too good, everything too good. So when somebody is too good, then you try to too good to be true. So then you start to look for any deficient symptoms or not. For example, anemia, right? I mean that's the most obvious one. People look for anemia, but that's not the only signs of malnutrition. It can be very subtle. Basically, you have to ask whether the person has giddiness or not, low energy, things like that. Actually, sometimes forgetfulness, postural giddiness symptoms. When they have it, you have to dig a bit deeper. Right? Then sometimes when people who do a bit more, then you like for example, you do the basic package, you don't see iron, B12, folate.
Yeah.
So when people do a bit more the moderate size packages, then you see the nutrition one, they start to pop up all these things. Then you realize because their patient, the first few years they do very basic. You don't see, but the patient giddy kind of story along the way. Then one fine day they do a bigger package and realize actually it's this guy got B12 deficiency or something like that.
You also get giddiness often.
Yeah.
Francan's blood is a bit thick yeah. So we haven't figured out why his blood is thick.
Not the thick.
Viscosity, hyper viscosity syndrome. That one is a bit cheap.
So for now, right, because you say a lot of trending things, what do you think of OMAD also? I think
OMAD, 1 meal a day.
Staff also doing like 1 meal a day. It's technically a version of fasting also, right? Do you think would you advise to do that, or intermittent fasting, or like the Muslims do like the 12-hour fasting? What do you think the difference?
That's a good question. But first of all, I must confess that I'm still quite new to the practice of fasting. I mean, it's only this year that I managed to clock about 15 sessions of 16 hours of fasting this year. Yeah.
Okay.
So I'm still quite new, but I read this person, Dr. Jason Fung, I think, and he mentioned one of the Harvard or some professors, a famous study on fasting. There are different kinds of fasting, like stage 1, stage 2, stage 3, stage 4, stage 5. Stage 6. So it's basically defined by the number of hours of fasting. So it can be 16 hours, 24 hours, 36 hours, 72 hours, 2 days, 3 days, 7 days. And what will happen to the metabolic rate lah? So stage 1 and stage 2 is the classic lah. That means stage 0 is like immediately after food lor. This famous 16 hours is the so-called the triggers for the stage 3. OMAD wise, obviously OMAD means it's about maybe 10 hours. I mean 18 hours. 18 hours.
How long was the longest you went without food?
17 17, 18. Yeah. Basically 1 o'clock.
Yeah, for you
Share with us.
I don't even drink. I mean, I drink water only. I don't eat.
So you do like the sugar,
Yeah.
like no sugar like that?
Yeah. So I did it for 1 week, for 1 month. So 1 month only 4 meals.
Huh?
But that was because I broke up lah. So
It's good. Actually, over the weekend, I slimmed down. You know why?
you argue with your wife, right?
Yeah. So Sunday, Sunday, you know what happened? I go back to painting. I like to paint. If you want to see my paint, I got painting it at my home, right? So Sunday is my off day.
If you want to see Dr. Lye's paint, please
I'll show you next time. Yeah. Yeah. So when I painted in the morning, right, I paint all the way to the evening, and then because when painting is based on your mental focus, because you cannot lose the train of thought. Because you want to paint an imagery, that momentum must be there. So you know what happened? It was so distracting that I didn't eat. So remember I sent you guys for smoking cessation training. In smoking cessation, we also taught this distraction technique. Distraction technique. Yeah. So
is it the thinking that is distracting you or your wife?
I think mainly the painting.
The wife.
Are you painting your wife or not?
No lah, obviously cannot lah. I'm trying to shift it to the forest thing lah. Yeah.
Nature lah, bring to nature.
Yeah lor. But playing with the mind, I think is important lah. Yeah. So Francan, can you share with us that 1 week, right? Does your experience does it fall into the definition I mentioned just now? That means the first part where you use your glucose, then glycogen.
Right,
This is the theory. Then after that, the fat.
So
Then after that, what? Yeah.
Okay, so your body has those reserve fats in like your face, all these. So you see those people like fat one, the face very chubby one, this kind.
Yeah.
I saw those reserve fats lah. So during the first 24 hours lah, you get hunger pangs lah.
Yes.
Yeah, then you feel very hungry, but you only last for like maybe 15 minutes to 30 minutes.
Correct.
After that, you will
Experienced that
feel
also.
normal again.
Yes.
Yeah. For me, I don't get gastric lah, so it's okay lah. So after 24 hours, once you are past the hunger pang, then after that you just continue, you go and sleep or something. Then when you wake up, you feel hungry again. After that, you just feel like vomiting. You don't feel like eating anything.
Nauseous.
Yeah, you feel nauseous lah. So
for the next 24 hours lah.
Yeah, correct. So total, you feel the hunger pang for around 48 hours. After that, you won't feel anything.
You feel giddy?
Adjustment.
No, I don't feel giddy.
Adjustment period.
Yeah, that's the adjustment period. So after 48 hours, right, your body will start to pull in the excess energy from your face, your arms.
Then you see a visual change, is it?
Yeah, so I slimmed down in the first week. I lost 8 kg.
8
Ah.
Yeah.
1 week.
Then after that, I maintained my weight for the rest of the month. Even
You
though
don't lose any more weight.
I don't lose any more weight. Even though I maintain one meal per week. Yeah, then I feel more awake. I don't feel as tired. Yeah.
You drink water, right?
Yeah, I only drink water.
Drink water.
Then do you check your body composition
No lah.
before and after?
I didn't check lah. But I think I got check my weight.
But then what do you eat? What do you eat? Do you eat protein or just anyhow diet?
No, so for the 4 weeks I ate the same thing. I
Which
ate
is?
fishball noodles.
Okay.
Noodles, mostly carbs. Soup.
I mean, it feels like I never eat lah.
Yeah. I mean, your driver is break up lah, so
Yeah.
it's obviously it's the emotion part. Yeah.
Yeah. So I didn't even feel like eating lah.
But interestingly, you don't feel compromised, breathless,
No.
cardiovascular breathlessness,
The only
giddiness.
thing I feel is a sharper jawline lor.
Yeah, that's the visual lah.
Feel the sharpness. Try. Cut already.
Yeah.
How about our Muslim friend here, Matthias?
Okay.
Matthias, can you share with us? I'm most interested in how do Muslim
The Muslim
experience the fasting. Yeah, do you have all these things that we experience?
For me, my parents started training me around 4 or 5 years old. It was, and I never do like some people do half, right? And when I was 4 or 5 years old straight, we do the full fasting. That means from sunrise to sunset.
Training from young.
Training from young.
6 to 6 lah, around there. 5 to 5.
Plus minus 6 to 7:30 kind of thing. Yeah.
So it's about 12
at least
hours.
12 hours. Yeah, at least 12 hours. So in the beginning, it was, I don't remember much lah, but I remember my parents telling me still adjustment period, like tired lah, all this. But usually, to me, I think it's more in the mind lah.
How old are you now?
Now I'm 28 lah.
Yeah, initial
27.
already.
Yeah.
20
But
years
yeah lah,
old.
so usually like 20 plus years of fasting to me is like normal already. Yeah, but still you can feel the fatigue, you feel the tired if you train a lot. Like for example now, cause I'm gymming, but last time when I was in army also, we go, the training is more strong. So you lose a lot of water. That's the first thing you will
Can I
feel,
interject? Muslim fasting, can you drink water?
Water also cannot.
So there's a difference.
So
Yeah.
no water, no food. Yeah, so that's the first part. You feel the dehydration.
Because for intermittent fasting, can drink water.
Yeah, water.
You drank water, right?
Drink water.
Like once every one
When
day.
you remember.
Ah.
When you remember.
Okay, okay,
Yeah,
okay.
So the first thing you'll feel is the thirstiness.
Okay.
Then second thing, the tiredness will come from like very hot weather, all this kind of training. Then usually during the end, then some people will feel a bit more like angsty. This one usually
The hunger
end.
pang thing lah.
If
Yeah,
you try
that's
fasting over the 12 hours, like maybe you go to
More
like,
than 12
like
hours.
level 2, like 2 days.
I mean, okay, this one for
Like your mom
us,
scold you, then you don't want to eat, then you just fast.
okay, for us, like our spiritual fasting, we are not allowed to do more than that. There's one thing, maybe some people don't know this, or some people have misconception. You fast more like the whole 1 month. That one is not. So it's sunrise to sunset. But yeah, but for that question, right? I think last time back in schooling days where I game a lot all that, then I will eat only along the way but we can totally forget like same thing as what you say
So
you distract yourself.
that one
so
also haram.
that one also not advisable to do. But yeah, so that's the experience You will feel the tiredness when you exert, but end of the day it feels like a mental thing.
So actually, when I'm doing intermittent fasting where water is allowed, coffee without sugar is allowed, right? I don't feel tired, but I feel agitated because I have these hunger pangs. The hunger spells. So from medical training, we know that the anxiety, agitation, feeling is all that of hypoglycemia.
Every time
Right?
you're hungry, you just go and drink water. Until
Okay.
you
So
feel
that's your
bloated.
Then you see Matthias experienced tiredness, right? Actually, that one is most likely dehydration.
Probably.
Yeah. So there is the difference between so-called intermittent fasting practices and Muslim practices. Okay, so there is a dehydrational component in Muslim fasting. Actually, I want to add. There was once I think I had some depression fasting also. No?
Maybe your wife again.
I can't
And
remember
last time
lah.
must be
Maybe my
ex-girlfriend
ex-girlfriend mistress. So actually I did the same thing. I didn't eat from morning until about 6-7 o'clock. I do feel totally like a sack of potatoes, something like that. Very flat. It feels more like what the Muslim fasting kind of fasting, and I think it's the dehydrational part.
Dehydration.
Yeah.
So would you say the cheat code for people to do intermittent fasting, OMAD, drink a lot of water?
No,
Yes.
it's to have depression.
Is the
Go and argue with your wife. Yeah.
Go and
Argue
purposely
for-
argue with your wife. Or,
Then
but
you get
I think the cheat code is actually water, 0 calorie stuff like matcha, coffee, where there's a flavor. You know, the matcha, the coffee give you a flavor. And then from the smoking cessation, we learn you can play with the coffee in your mouth for a longer time. Our trainer teaches to play water in your mouth so that you distract, because the hunger pang only lasts for about 10 minutes. So, you just need to do something a bit more focused on for that 10 minutes. So one of them is the playing with the water. So instead of just drinking water, you just put the water left, right, feel the texture, feel your tongue rolling. Just play with the water. That will last about maybe 1 minute. So you can do likewise for coffee. Try to pause and enjoy the coffee. Then while you are focusing on the coffee flavor, texture, and the temperature, you will take out 1 minute. So every 1 minute you take out as you ride over that 10 minutes. Then you can ride over the hunger pangs. Yeah.
I guess that's how Chalgi also work with the tiny
Correct. I think Chaji is right. Trying to do is I help the person to enjoy the
correct,
mild
correct.
flavor
That's
of
what I heard.
the thing. Yeah, correct. So that's the thing I like about the GP because it's applied psychology. I like this kind of thing because when we learn about human behavior in psychiatry in psychiatry practice, they got this thing called CBT, cognitive behavioral therapy. So as a student, I always a bit clueless, cognitive and behavior, what's the difference? Especially for behavior therapy, right? Cognitive basically therapy is like, why are you depressed? Can you look on the bright side? Cognitive therapy is based on logical discussion. But behavior therapy, the classic that were taught as a student is like, for example, cockroach phobia, right? And then first I talk about cockroach, you get worked up. Then after that, I decondition you until I one fine day give you some cockroach, and then I make you touch the cockroach, right? Then eventually I will cure you of cockroach phobia lah. But that was the basic model for behavioral therapy. But I find that applies for psychiatry practice. We don't manage as GP, we don't manage phobia at all. But I'm always intrigued that can't I use the discipline of BT on our behavioral challenges, right? And the closest that I get is smoking cessation. But you see, the biggest elephant in the room that we have in society nowadays is eating problem. Right, a lot of our chronic diseases, fatty liver, hypertension.
Eat too little also.
Yeah, correct. So I think with this many years of practice, I finally see the light in the tunnel. I must thank the world in the sense that everybody is chipping in, in terms of public opinions and technique. Yeah, I think it was quite daunting 10, 15 years ago. I think just before the ex-Prime Minister Lee Hsien Loong declared war on diabetes, just before that, I find it pretty daunting to conquer this growing incidence of diabetes. Post that era, I think a lot of data are coming out and that certain things are that with right and wrong, we are becoming clearer, and then it gives us new hope lah. Yeah. I think is quite a good time to practice GP. Yeah.
GP is always there lah.
Yeah. General means adaptable, right? We move with time. As a society change, the healthcare needs change. We also change along the way. Yeah.
So the last time, right, we also mentioned about BCA.
Yes, body composition.
You can count your calories and all this like that.
Yes,
right?
yes.
So some people, right, when they eat OMAD, they eat one meal but then they got like Burger King lah, they got McDonald's lah. So their calories one shot become 3,000 calories. You think that kind of like so-called eat a lot one day only, does that work for most people? Is it healthy to eat like that?
Well, I mean offhand, I can imagine the sugar spike and the massive sugar spike, the massive lipid spike, the massive salt overload, overloading your system. If you are a middle-aged man like me, I literally can imagine I get salt volume overload and I will become literally breathless. It happened to me before. Yeah.
So
Because I'm not.
Is it true that if you eat a lot, right, you shit a lot also?
Yes, that applies to me because I'm a foodie. Yeah, there are days during my off days where I'll just overindulge and I find myself passing more frequently. Yeah, it's correct.
Depends on what you eat also.
Yes,
Yeah. So some people, right, they like for us we eat like protein for when we do bodybuilding or this also. Wow, some people get like constipation some people get even smellier farts all this. Apparently it's a true thing
Yeah.
Shit is an interesting thing to say actually.
Everyone say my fart smelly, but I don't think so.
Maybe you eat a lot
I eat a lot of meat.
Yeah, you eat a lot of meat I
always get constipation.
I think it's like chemistry and cooking, right? Enough water or not, your output water, your electrolytes, your fibers, the mixture of things lah. Maybe that day you are outside, sweat more, that kind of thing. You had a long day. Long day means that you're outside, then your metabolic and water expenses are more than you expected. Yeah, because your colon is a natural sucker. You suck out all the water. So I call it basic maths. You didn't get a maths correct lah.
So it means that my colon is working well lah.
I mean, my standard for working well is
constipation.
I think you should purge every day lah. Yeah, I think you should purge every day. Yeah.
Purge. Okay.
Because 3 meal in, 1 meal out, I think is reasonable. 6 meal in means 2 days. 6 meal in, 1 poop out, I think is quite loaded full. In terms of simple maths. Yeah.
Some questions that we have for all this, right? we have something that we call, this is from our Gen Z stuff. They ask, what do you think of girl dinner?
Wow,
Girl dinner. Have you heard of
no,
that?
I haven't heard of that. Or Gen Z stuff. That's
Hardcore.
new. That's new.
So okay, girl dinner so far what I understand is mostly about eating very small or minimal meals only. So like so called like bare minimum to survive. Because for the term girl dinner, like girl math, all this basically means like to them this is enough lah. I think give example lah.
Wrong lah. Some girls eat a lot one. Our staff, some of them they eat a lot.
But that one not girl dinner one lah. Example for what girl dinner ah?
The breakfast, lunch, dinner all eat.
All eat lah, but what if they eat crackers or they eat cheese and grape? All these like simple food lah. To them it's like one dinner like that. Even if you eat like morning, like your breakfast, lunch, dinner, they eat like that.
Okay, offhand, off the cuff.
It's a trendy thing apparently.
Oh, is it? That's interesting. I mean, we must be open-minded to receive, because what trends, there must be some fairly convincing, compelling logic to it, lah, right? If it's sustainable, most likely it has some physical impact that is desirable, right? But anyway, from off the cuff kind of interpretation, okay, one presumption that I will presume is that these people are maybe perhaps more sedentary. So their basic hourly metabolic rate is low, requirement is not high. That's one. Then number two, being sedentary for the longest time, their resting basal metabolic rate most likely also is low. So everything low lah. So low demand, low resting metabolic rate. So you don't eat much mah. So therefore you just eat a little bit and you won't get this hungriness at all.
Similar to like what you say just now, like after a long period, you just eat once.
Yeah, you become ill caloric.
But the difference is I still work every day. Yes, I'm still in the clinic.
Then your calorie output also high lah.
Yeah.
Oh, actually, let me differ a little bit. As a clinic work, I suppose you are standing, you are sitting, you are standing, you are walking. But I think compared to things like manual worker, delivery, food delivery, the calorie output at most I can give you is standing. The standing calorie, I think it's about like maybe 70 calorie per hour.
Because usually the girls in the clinic they'll bully me. So I'm the one climbing, standing, walking.
You're a man what?
I'm a boy.
I'm still a boy You
still
never go army on this one. Never go boys to man.
But having I mean, if you talk about depressive fasting, right? I used to I saw a maid. Last time I saw a maid. Then the employer bring the maid and see me.
Carry back one.
No.
The maid need to carry
Not
back.
No, but the thing is, this maid got no menses for 1 whole year. So the employer say, hey, what's wrong with my maid? Kind of thing. So I saw a few of this kind of maid. Then we checked their hormones. Actually, the hormone shut down. Hormone shut down. Stress. So culture shock. I call it culture shock, because when maid come to Singapore, are new to the workplace, they culture shock. Some don't take it very well at all. They actually switch off not just at the ovary, but they switch off at the hypothalamus. Yeah. So for that case, she got central hypogonadism. It's even worse than ovarian hypogonadism.
Being a guy is stressful. We don't even have periods.
So actually, stress itself can really
You want period
alter your perception but it's I think it's super natural
Quite interesting
it is a bit not so easy to generate that kind of physical force to suppress the appetite for most of us. It must be something.
The link between like diet and like mental.
The hypothalamus, the hypothalamus is our appetite center.
They got menopause, they can stress other people. Come and kacau us at our clinic.
Maybe maybe you disturb them also lah.
For women's health, right? We know that short-term stress, right? If the stress is stressful but is short-term, right? They get menstrual delay. Then after menstrual delay, they get heavy menses. Because basically I call it constipated uterus, right? But when they come very heavy. Delay. So a 4-week cycle becomes 6-week cycle. When the menses come, they get 6 weeks worth of menses to come out. So the endometrial thicken. That's short-term delay, short-term stress, right? But just like I told you that case, the central switch off is severe stress, culture shock. This is a bit more at the hormonal level already, yeah.
Basically, caloric in, caloric out, like what we mentioned about eating too much or stress or this. And then you mentioned about how if you're having a sedentary lifestyle, right? So is it okay just to summarize everything that in like calorie in, calorie out?
The simple answer is yes, but there are some factors that is not very easy to calculate. For example, the metabolism that is utilized for growth and development. So as a middle-aged man, I lost that developmental part. I remember when I was a young man, I am not so sensitive to weight gain, right?
Okay.
Yeah, but
Young
when
girl,
Because it's already at its maximum already.
no, like the male menopause.
your time will come,
Male
Francan.
menopause.
Yeah, you think you thin forever. You look at your father, your father pui pui one, next time you become like your father.
So
Okay.
genetic also lah.
No, I mean when you become old, the physiology change. Yeah, so
male menopause lah.
correct. So that part, I don't think is easy to calculate.
So last time you very fit, right? Is it?
Yeah, I can. My
No, I
24
mean,
click is
your body, your stomach. How
yeah,
long
yeah,
you
yeah.
come up?
Got 6
my 21 half marathon. My timing is 1 hour 52 minutes.
I don't know, I never run.
Cardio only.
Not too
But he more
bad.
fit than us, He more athletic than
I can do 22
At
pull-up.
what age did your stomach start coming up?
When I start my career, GP and my family stress lah.
So is it true like when you get married, like your wife, your
Yes.
stomach will come up?
Yeah.
I would say the answer is yes leh. Look, is your
Oh.
parents all fat one?
Stressful, I know only my mom fat.
After
Huh?
Only my mom is fat. My
Your
dad-
mom fat.
My dad last time also like fit one. That's
Ah,
why
then?
my mom very
And then after
then
that.
now also
So I actually I wanted to do this experiment. So I let it be. I let myself put on weight, and then when my child grown up, then I tell myself I'm going to pull it back, right, using my medical techniques.
So how far back are you into putting it back?
Well,
5%?
I got my fitness back 60%.
wow.
Because as a middle-aged man, I realized that I have to be not so aggressive about my health journey because I'm more prone to injury. Somehow the biology, like for example, recently I learning this deadlift thing. I do the deadlift with my weight loss medicine at low dose. I use very low dose, but I still find my deadlift recovery. I got my leg hip adductor strain. It took me 6 weeks. I was walking like a crab. That was in December. Yeah.
So were there any times like a patient say to you, right? Dr. Lye, you so fat, then you ask me to run. I run for what?
Yes. So there are times that there will be patients who say, hey, doctor, you don't look tip top, that kind of thing. I find that there are two ways to it lah. I walk through what the patient walked through. I think I will have that sympathy with the patient, because there are some people who are naturally 6 packs one they maybe have no sympathy right. So people, I'm with you. I always tell myself that I'm with you because I know what you've been through. Either because of ignorance or because of stress. That's why you become like that. Because I was one of you. As a doctor, I knew that I was becoming unhealthy. It is because of the social stress and all that stuff. And then I told myself that when I have the chance, I will turn myself around. And these are all because of the social pressure, right? The pressure of the taking care of family and the work, things like that. So actually, as a family doctor, social analysis and counseling is an important part of the management, because if the person don't manage the social wise, sometimes even if you give plenty of medicine, it just doesn't work. I give you an example. I got this lady, she got cough and cold. Right, very, very, very bad. Gave her Augmentin, an antibiotic. She got well. Then 1 month later, she came back with the yellow phlegm again. 1 month later, exactly 1 month later. And then you know what's her background? She got a young baby at home. And then she finished her maternity leave. She went back to work for the first month. And go back to work, come back, still have to feed the baby overnight. And obviously she tried to avoid the antibiotic and all that stuff. But you know what? I've been through that before. And my kid was young. I find myself, I keep falling sick. I just cannot get well one. Yeah. So that social part, what must you do? You must rest. REST.
think
Yeah,
that's the
augmenting won't work completely for you one.
on its own lah.
Yeah, the social part must be highlighted to the patient.
I think that's the difference lah, being a GP doctor
Yeah.
rather than having AI doctors nowadays.
Yeah. Oh, I
That
think that's
human
a
touch, right? Don't
yeah.
have lah. So talking about how AI is compared to how GP is like lah. The real doctor that we are seeing, like you yourself are. What do you think about people, right, who before AI come about, it was Google. Google search their symptoms and then see self-diagnose lah. This kind of thing. So let's say I Google and say I have a runny nose, headache, blah blah blah. Then suddenly everything come out cancer. Yeah, this kind of thing. What do you think is the legitimacy of AI?
So in that sense, you gave the answer already. That even before AI, the Google search era could have replaced the doctor, right? But it didn't. Actually, vice versa, the 10-year series could have replaced the tuition teacher, but it didn't. Right? Why do we still need teacher or tuition teacher when there's a 10-year series? You can do 10-year series, but obviously it's more than just the text. You are dealing with a human being. Whether how the person received the information, there's a lot of reading of the readiness of the person, the language, the intonation, the repetition, so things like that. And in the information train A, B, C, D, E, F, G, H, I, sometimes the real practitioner will tell you the B is more important, E is more important. It's not A, B, C, D, E, F, G. So likewise for a tuition teacher, they will tell you what is the essence of the topic. So as a person, as a doctor, we kind of like, we are a bit more in your position rather than the whole bunch of information lah. Yeah, so I think that is the direct response. Then for AI, is very exciting because when I started to use it, I also feel the excitement. Very promising. I see it more as a help. So I don't see it more as a threat that may make doctoring irrelevant.
So you think AI and GP work can go hand in hand?
Yes. In fact, I find that AI will actually help my clinic staff, non-doctors, help the patient even more, not just the doctor. I mean, let me just shift a little bit, because as a GP, we work as a team. Because a lot of time the information need to be repeated. Like for example, Panadol, you are supposed to give your son 3.5 meals, 4 times a day, maybe 3 times a day if it's not so bad, but 4 times a day if the fever is very high. So this kind of statement, sometimes when the patient may not remember. So who is the one to repeat all these messages? My clinic staff. Because sometimes the patient forget it the next day, they will call the clinic, I won't be around. So my clinic staff is the one that actually will repeat all this kind of information. And this is a very simple statement. But when it comes to something more complicated one, I think with AI, which is more capable of carrying this kind of messages, it will help my staff become more confident in terms of sustaining the information flow for the patient. On the patient side, doctor, clinic staff, and patient, the patient will be more empowered because they can actually ask more in-depth questions of the topics lah. Yeah. Then for the doctor side, of course, at the end of the day, is we are there to be the final real person to give you a so-called second opinion or third opinion. Yeah, I find that part it still remains relevant. Another point about doctor is that I want to say is that moving with times. So as the practice, so-called, for example, the Google search comes on, the older doctors, some of the older doctors may become obsolete, but those doctors that continue to improve, catch on with times, they will remain relevant. Then you can presume the new doctors will be AI ready lah. Just like the new workforce, the middle workforce, and the older workforce. Generally, the older workforce, the attrition rate will be higher. That's how it is, right? But the middle workforce will catch up, and of course catch up and take advantage of the new technology, and remain relevant to the patient or the customer.
So if, for example, AI, right? Just now you mentioned people, it will empower people also.
Yes,
right?
patient,
Patients,
clients,
right? So when do you know, AI answer is enough, and when should I come to the doctor to see? my problem.
Yeah. So as once again, I love being a GP in the sense that as the patient becomes more knowledgeable, I will have to automatically become even more knowledgeable, because otherwise there's no reason why she come and see me, right? So it's because of this demand and supply thing that's pushing the industry lah. Likewise for the once again my clinic staff. Long time ago, the clinic staff are aunties, they don't need to know computers, right? But nowadays, if you don't know computers, you can't even become a clinic staff. A lot of difference. Yeah. So the next generation of clinic staff, I can envision, right? They will be care coordinators. Care coordinator. I'm very excited about this component, because it will make actually the GPs a lot more capable and helpful to the community. All hands on deck. One doctor only got one pair of hand and one mouth. So if I have a lot of staff supported by all these technologies, I think I will be a lot more effective in terms of for the community lah. Yeah. Especially each generation is better trained and educated. Is a lot different from the auntie times. Nowadays, we don't have any more aunties already. Our staff are all very intelligent, all very capable, and they are all very ambitious to be of value to the customers lah, right? And it's a matter of time that the society will recognize the people that works for the GP sectors, right? I'm quite excited about it in that sense lah.
I think it's underlooked lah. There a lot of the value added when you come to the clinic experience, actually the clinic assistants themselves as well.
Correct.
The doctor can only give so much under medical treatment or this kind of thing, but a lot of how you want to really know how to use the medication, you can ask for the illness, then you want to know about other things that can help you, which you cannot go inside. The doctor only has so much time for other patients as well. Yeah, you can always ask the clinic nurse and all that.
I think I give you another parallel. Private law firms, they have legal assistants. So the next generation of GP assistants, right? They will be like legal assistant. Not your aunties. Yeah, there are no more aunties anymore. So legal assistants, sometimes they actually do literally what the lawyers do, right? They do the documents, they do the checks and all that stuff. The typing, the correspondence, all done by the legal assistant. Very sophisticated, supervised by the lawyer, things like that. So the next generation of GP work most likely will be this kind of stuff. Okay, having said that, for legal work, of course, it's all about informations, right? Information intensity. So in GP, the practice, not all GP practice are information intensive, right? For example, a procedure, injection, during phlebotomy, minor surgery, or see a cough and cold case. These are very short exchanges, right? But nowadays, there's a new horizon, a longevity clinic, lifestyle medicine, where health coaching, right? Coaching, or my cholesterol is very high, over and above my statin, what else can I do? Right. So once again, going back to exercise, dieting, and then how do we come to the clinic to authenticate our progress? So all this, there are a lot of information, like for example, how do you read your full blood count, kidney function in association, health coaching, information. So a lot of time, this information intense service will be very similar to what the legal assistant will be doing. And then with AI, I think it definitely can be done, because for the longest time, we have as a doctor, we have challenged trying to train our staff adequately. But with AI, I think it's going to be much easier.
So if you're looking for staff that are coming in, you're looking for like more tech savvy, what kind of stuff are you looking for?
I think that one, generically, of course, your attitude must be good. You must have the ambition and all that stuff to serve. Yeah, but in terms of being savviness, you must be up to date lah. Of course, you must. I think you must share the vision lah. Then you will find that your job will be exciting lah. But young people sometimes they are still a bit lost or still searching. Then you may not be as successful. But if you share the vision that I can see, it will be very exciting. And then you will know why are you here in this workplace. And I think once again being educated, being more open-minded, this young generation, I think they are more ready, right, to benefit from their experience, even in this GP sector. Yeah, I think there's excitement here lah.
So are you hiring any more staff?
I suppose so.
Clinic?
Yeah,
Right?
yeah.
Are we hiring more staff for the clinic, right?
Tomorrow
Yeah.
I ask my sister to join.
Yeah.
Ah, you have a
I think
sister?
we'll get lah.
Primary 5.
Oh, primary 5 ah.
Yeah.
Your mother?
She got passion
Yeah,
for
but
this.
we got
Oh.
secondary school with staff also working.
Yeah.
That's not- Okay, yeah, so if you're interested also, our working lifestyle in the clinic also quite interesting. Maybe. And if you're interested to join Etern Medical, then maybe next episode we'll probably get some of our actual nurses and we'll tell you how healthcare life is about. Alright, thank you so much,
Yeah.
Dr. Lye. This is our episode 2 of Take MC.